When we decided to reopen or lift some of the restrictions at the borders to allow persons to come in, a decision was taken to test all persons that were coming in. We started out with very few air flights coming in that returned some persons, and we tested those persons. When we moved on to returning our Jamaicans who were working on ships who needed to return, we tested all of those persons that were coming in. At that time, the numbers were small enough for us to handle, but however, as we moved to larger numbers, it became more and more demanding with large use of resources. We decided to reopen the borders to flights coming in by air in June, from June the 1st, first to Jamaicans, and then on June the 15th to tourists. At that time, a decision was taken that we would do a period of testing to determine what was the positive rate of those persons that were coming into the country. And several persons were picked up as being positive. We had about a 1.3% positive rate in the persons that were coming into country at that time. And most of these persons would have been tested that were asymptomatic. We had very few persons that were with symptoms. As time has gone by, however, and more restrictions have been lifted, then the volume of persons that are coming into country has become larger, more than we can manage to continue to do routine testing at the airports. We're not only faced with a problem in terms of the human resources to carry out the testing at the airports, we're also faced with capacity issues in terms of supplies, because as the number of cases grow worldwide, the demand by the manufacturers of these supplies, including swabs and testing reagents, it becomes harder for us to get the continued amount of supplies that we need to continue testing. So there are various issues that we have to contend with in terms of going forward with testing. Now that we have reached this point in the epidemic in Jamaica, it becomes even more important for us to be able to test persons that have symptoms within country, and not so much to focus on persons that are without symptoms that are coming in at our airports. So we have now stepped back a bit in terms of the testing at the airports, and we are now testing only some persons that are coming in at the airports. And this is to give us an idea of whether or not we continue to have positive cases coming into country. Over the last couple of days, maybe in the last 2 to 3 weeks, we have tested thousands of persons, and that has created a little bit of challenge in terms of returning the test results in a timely fashion. At the present time, we have results that are backing up 2 weeks, probably a little bit more than 2 weeks, and if we continue to test at the rate that we're testing, then that backlog will increase. Now, we are moving to clear that backlog as quickly as we can, but we do recognize that there are persons that are waiting for results. But what we want to emphasize to these persons that are waiting, we ask them to be patient in waiting for the result, but we also ask them that they remain at home for the 14 days quarantine period. And if they do develop symptoms, that they get in touch with the health department as quickly as possible. Because this is where we have to move towards in terms of monitoring persons that are coming into the country. The test that is done when they come in initially is a one-off view as to what is happening. But many persons are within that 14-day incubation period and will have negative tests. There's a false sense of security that because you've tested negative, you are now free to move around. However, any time within that first 14 days after an exposure, someone can become infected. And so therefore, the 14 days of observation is really what is key. And persons need to stay home. The family members, the community members must become aware and be alerted if they see persons outside who they know have just returned from countries and where they would have had an exposure to COVID-19. Everybody has to be vigilant. Every single Jamaican has to be vigilant to keep those persons at home for that 14 days. Because when you become symptomatic during that 14 days, that is when we will test you. We are moving away from testing persons at the airport when they come in. Right now, we continue to sample some of the flights in order for us to get an idea if there are positive cases that continue to come into the island. But persons will become positive during that 14 days, and so they must let us know if they develop symptoms.